Welcome to the James Cooley Show. It's your life. I'm your host, Dr. James J.C. Cooley, and we got another absolutely fantastic show coming your way. Got somebody that's special and dear to both Michelle and I. That's going to come on the show and talk about a lot of things as it relate to pediatrician kids and other things. And so we're excited to have him on the show, and I'm looking forward to it. So how you doing, Michelle? How you doing today?
I'm doing good, doing good. Yes, we have this amazing pediatrician. He's one of the top docs in Atlanta, Georgia, and top pediatricians in Atlanta, Georgia. And he's going to talk about a topic today that I never heard of. I don't think you've heard of either, but he wants to educate the audience regarding this. So we're really excited.
I'm excited about that. But hey, my main man Todd back in San Diego, how are you doing today?
I'm always good, even better on a Friday.
Well, absolutely, man. I'm ready to get this thing started. Can we do it? Can we get it started?
Yeah, we're going to start here in about 20 seconds. We're going to lock everything in.
I'm looking forward to it. 20 seconds. Todd is enjoying the San Diego weather and being back in San Diego. So
yes, and I got to say, go Padres.
I'm proud
of Yankees, go Mets.
No, go Padres. We got to be we are locking it in.
Okay. It's Your Life is sponsored by James J.C. Cooley.
Dr. James J.C. Cooley. The James Cooley Show.
Hello. Welcome to the James Cooley Show. It's Your Life. And, I'm your host, Dr. James J.C. Cooley. And I tell you, we got a very exciting show coming your way today. We got a returning guest, been on a couple of times, but he's going to talk about a topic that's, I think, should be dear to all of our hearts. And he is one of the top docs in Atlanta, Georgia, pediatrician, and does so many great things there. And he's going to share a lot of great things with us. So I tell you what, whichever platform that you're watching us on, if you want to be part of the conversation, all you have to do is just go to the platform, whether it's 360 Television, Transfer TV, YouTube, LinkedIn, Twitter, Facebook, over 6 to 8 live platform. Welcome to the show. If you want to be part of the conversation, just go to the comment, ask any question that you might have. Or you can pick up the phone and dial 1-888-344-1170. Again, that's 1-888-344-1170. How you doing, Dr. Cooley? How you doing today?
I'm doing great, James. We're going to have this returning guest. He's a pediatrician, and he's going to talk about a topic that I never heard of that affects newborns. And we're really excited to have him back on the show.
And plus, he's very dear to both of us because he's your brother. Dr. Lester Freeman. So I'm happy to have him on. Michelle, can you do the honors by introducing the title of the show, purpose of the show, and please introduce this absolutely fantastic guest.
Yes, the topic of today's show is called Shoulder Dystocia and Erb's Palsy. And we're having a sit-down conversation with Atlanta pediatrician, Dr. Lester Alexander Freeman. He's going to tell us what exactly is shoulder dystocia and Erb's palsy and the risk factors involved in both, and prevention and management strategies, and so much more about these two conditions. So Dr. Freeman was born and raised in New York City. He knew at an early age that he wanted to be a doctor, a physician, but mostly a pediatrician. Our father asked him one day what he wanted to be, and he said a doctor or a lawyer. He phrased a doctor. He asked him what kind of doctor, and he thought about it. He said one that takes care of kids. So he is a well-known pediatrician in the Atlanta, Georgia area. His motivation for being a pediatrician stems from his fundamental love for both children and pediatric medicine. His daily goals include educating his patients and their families about pediatric health and inspiring as many children and adolescents as he possibly can to become interested in pursuing also a career in medicine. So please welcome back to the show, Dr. Lester A. Freeman.
Thank you. Thank you very much. It's a pleasure to be back here again.
It's a pleasure to have you again. We're really excited about this topic that it's the first time we heard about it when you mentioned that you wanted to talk to educate and motivate the audience regarding this. So,
hold on. Hey, Dr. Freeman, can you adjust your camera? Your head is cut off.
There you go.
A little bit more. No, it's completely off now.
It's completely off. Okay.
Yep, that's perfect.
There you go. There you go. That's perfect.
All right.
So, hey, Dr. Freeman, welcome back to the show. It's always a pleasure having you on, man. And
Thank you.
because you educate our viewers and our listeners so much. And for the viewers or listeners that did not see the last time you was on the show, can you briefly give them a quick understanding of who is Dr. Lester Freeman, and what he stands for, and why you're so passionate about what you do?
Well, like your partner in arms right there said, she's my sister. And when I was a kid, when I was 5 years old, my father asked me what I wanted to be when I grew up. And this was during the holidays, during Christmas time. And after I gave him my extensive Christmas list, he gave me that question, which no one ever asked me before. So I thought about it and couldn't come up with an answer. So my father whispered in my ear, doctor or lawyer. And so I yelled out, doctor, and he clapped. He goes, what kind of doctor? And automatically I just said, baby doctor. And he got even more excited. And that's been my answer for years and years and years until it finally manifests itself. And I became a pediatrician and graduated at UMD&J Rutgers Medical School.
Mm-hmm.
And I did my 3 years also at Rutgers residency program. And I worked for a couple of years in Temple Children's Hospital.
Mm-hmm.
And I made the decision to come to Atlanta and work with some fine physicians, including Dr. William Bland and Dr. Myers Joseph. And the name of the pediatric practice is called TLC Pediatrics LLC, or Teens, Little Ones, and Children Pediatrics LLC.
Oh, I like the acronym for this your practice.
Thank
So
you.
can you tell us, why do you want to discuss the topic of shoulder dystocia and Erb's palsy today? Why did you want to talk about it?
Well, one, I've seen it several times. And even though it's a very rare condition, but it's a condition that once it's affected the newborn, you'll never forget it.
Okay.
Yeah.
Dr. Freeman, tell us exactly what is shoulder dystocia. Educate the audience, please.
Okay. In a pregnant female, shoulder dystocia, basically the word means when one or both of the baby's shoulders gets stuck inside a woman's pelvis during childbirth. The word dystocia comes from the Greek word dys, meaning difficulty or painful, and tokos, meaning birth. And shoulder dystocia, whenever it occurs, is a medical emergency. And babies with this condition are usually born safely, but it can cause serious complications for the mother and her baby.
How often does this happen, Dr. Freeman?
Well, it's a rare condition, and statistics vary widely because the condition is somewhat overdiagnosed or underdiagnosed depending on which facility this occurs in. The average rate also depends on the baby's birth weight. It occurs in 0.6% to 1.4% of babies weighing between 5 pounds, 8 ounces, and 8 pounds, 13 ounces at birth. But the rate increases to 5% to 9% of babies born who weigh more than 8 pounds, 13 ounces.
Does this issue sometimes result in death, or is it just, I know you guys do so many great things to save the baby and make sure that it's healthy. So can you talk about that a little bit more?
Well, it rarely leads to death, but it does lead to disability and impairment. And whenever a child is born, every parent wants the child to be perfect. 10 fingers, 10 toes, 2 eyes, 2 ears. So when there's something off in the on their baby, it becomes magnified.
Or when you are delivering the baby or prior to, can you determine before the baby is going to be born that is something is wrong, or do you discover that during the delivering of the baby?
Well, there are some factors which lead to the suspicion of shoulder dystocia. For example, fetal macrosomia. That's when the baby weighs more than 8 pounds, 13 ounces. When the baby's in the wrong position. And that can be determined via ultrasound or bimanual exam or physical exam. Whether the pelvic opening is too small. And so those are the major ways it can be determined. And there's other factors too. If you delivered the baby's head, but you aren't able to push the baby's shoulders out once the baby starts crowning, or at least a minute has passed since the baby's head has been emerged, but their body hasn't, or if your baby needs medical intervention to be delivered successfully. Hello?
So there are ways to determine.
Yes.
And doing that, I guess the delivery room and everybody's ready for it.
Correct.
For
now, well, I mentioned before about the baby being large. There's a couple of conditions where the baby is extremely large. That's one, if the parents are extremely large, like if the mom is very tall and very, wide, and if the dad is also the same, you anticipate the child to be just as large as the parents. And also diabetes. If mom has gestational diabetes or she's a diabetic, whether it's type 1, type 2, chances are the baby's probably going to be larger than the baby would have been if mom did not have that condition.
Well, hold that thought. We're going to take a station break, but I tell you, this is so interesting. This first time I ever heard about this. I wouldn't call it a disease, but I'm talking about this problem. And we're going to take a station break, but when we come back, we're going to dig deeper in here with Dr. Lester Freeman and just get a better understanding of all of these things. I tell you, if you want to be part of the conversation, all you have to do is go to the platform that you're watching us on, ask any comments that you might have, or pick up the phone and call the radio station at 1-888-344-1170. Again, that's 1-888-344-1170. It's your life, and we'll see you shortly after the break.
There's more stories of greatness to help you overcome adversity coming up on It's Your Life with James Cooley.
A Black Man's Point of View is the newest Amazon.
Hello, welcome back to the James Cooley Show. It's your life, and I tell you, our guest here is Dr. Lester Freeman, one of the top docs in the Atlanta area, and I tell you, as it relates to pediatrician, you're doing so many great things, and you're talking to us about a certain type of birth, where I guess I wouldn't say everybody or many, but some people experience this, and it's called shoulder distortion and Erb Palsy. And he's going to talk about a little bit more about that later. And I tell you, it's been interesting so far, and I can't wait to get some more information on here. So I'm going to turn it back over to Dr. Michelle Cooley.
Yes, thank you, James. Dr. Freeman, so let's talk about shoulder dystocia. So what are the immediate interventions used to resolve shoulder dystocia and safely deliver the baby?
Okay. The first intervention is, of course, an emergency C-section. Okay. And also an episiotomy. An episiotomy was when they cut, when the OBGYN actually will decide to deliver the baby being an incision through the perineum to make the opening to the vagina larger. And they will, of course, they will talk to the parent prior to doing this procedure and make sure that the procedure goes off smoothly. And they also have a number of maneuvers called McRoberts maneuver, and in order to put pressure on the mom's legs in order for the baby to be delivered safely. There's suprapubic pressure is another.
Oh, Dr. Freeman, I'm just going to interrupt you. We want you to have your heads kind of cut off on screen. Just lower it right there. That's fine. Just stay right there.
Okay.
Okay.
All right.
So I'm sorry. Continue.
Also, they can try to roll the patient, meaning the mom, so that baby can be in a preferable, favorable position, so that the baby shoulder can be removed from the vaginal outlet safely and securely. However, there are risks and there are complications.
So let's talk about the complications. What are complications for the infant, and also what are the complications for the mother?
Well, the main complications for the infant is clavicular fracture. Sometimes the obstetrician will even break the baby's clavicle, which is the collarbone, on purpose in order to release their shoulders. But the main complications, of course, hemorrhaging, because when you're trying to remove a large baby from a small outlet, there's heavy bleeding on the side of the mother. They call it postpartum hemorrhage. Okay, and also severe tearing of the area between the vagina and the anus or the perineum. Also, something that could develop is called a fistula, which is an abnormal connection between the rectum and the vagina. And that can produce a lot of problems as well, including bleeding and infection. And one of the main complications is called uterine rupture, means the uterus tears during labor.
Wow.
Yeah, and also another one is separation of the pubic bones, which is extremely painful. Now, the complications that can affect the baby, in addition to the clavicular fracture or the fracture of the collarbone, is something called a brachial plexus palsy or brachial plexus injury. Now, anybody who doesn't know what a brachial plexus is, it's a network of nerves that's located on both sides of your axilla. Axilla meaning your armpit. And when that occurs, it could be very damaging to the baby, and which can cause a great deal of impairment. And I'd like to go over that in detail at some point during this broadcast.
Okay, so you mentioned, uterine disruption or rupturing, which
Right.
can lead to hysterectomy. Is that accurate?
It can, because once the uterine is ruptured, there's going to be a lot of bleeding, a lot of panicking, And so you have to, one of the things you have to do is stop the hemorrhaging as soon as possible. So that's going to be the main focus, is to save the life not only of the baby but of the mother as well.
So, how does shoulder dystocia affect future pregnancies, and what preventive measures can be taken?
Well, if the mom is large, then chances are there's going to be another large baby in their future. If the mom and the dad, and especially the mom, has gestational diabetes or any form of diabetes, whether it be type 1 or type 2, then there's an increased risk of the baby being born with macrosomia, which means large body. So which increases uh, the likelihood that the baby is going to be um, running into the same problems as the previous child.
Is this an inherited condition? Just out of curiosity, you said that the mother, if possibly, if she's large and maybe the father's large, but mostly the mother, if she's large, it's possible that this can happen in future pregnancies. Is this condition hereditary?
No.
Okay.
However, it's not genetically inheritable. However, the condition, like the condition which I gave you before, as far as the large parent or the
Hmm.
large parents, you're going to have large kids. For example, the reason why I brought up this topic is because this happened recently. Mom is 6'4", dad is 6'9". Okay, and they have 3 kids. The first one was born 12 pounds. The second one
Wow.
was born 14 pounds. The last one was born 15 and a half pounds. And it was the last one, and they all had shoulder dystocia. Even though mom was large and had a veritable large vaginal outlet, she still had issues with the babies with shoulder dystocia because the babies are abnormally large. Now, anyone knows anything about infants, the average infant is between 7 to 7.5 pounds. So, so the babies were born almost double the weight of an average sized baby.
Wow. Hey, Dr. Freeman, can you slide back a little bit because your head's deep off the camera and our viewers can't see?
Sure.
That's a little bit more if you can. But you had mentioned some of the long-term outcomes from shoulder dystocia for both the baby and the mother. As the baby grows, and do the functionality and all of that comes back, or uh, how does that work?
Well, it depends on the severity of the brachial plexus. Now, let me go over the brachial plexus again. Brachial plexus is a network of nerves, okay, that's located under both armpits, okay? So, if anything disrupts that entire network of nerves, a lot of bad things can happen. A lot of severe impairment, which, depending upon the severity of the impairment, can cause lifelong complications, where physical therapy, occupational therapy are going to be needed for a lifetime.
So, what would you suggest a parent uh, start doing if they have that problem with their baby? You mentioned 3 heavy babies,
Hmm.
13, 14, 15 pounds. Those are some big babies. Uh,
Right.
um, what would you suggest parents out there that might be listening to the show right now, if they had a baby that was born in that situation? What recommendations would you give them now to probably start implementing to help resolve any problems that they might have in the future, or the baby might have in the future as they continue to grow?
Well, first, when the OBGYN delivers this child, the child is going to be immediately examined by the OBGYN, and then handed off to the nurse, who's going to wipe the baby off quickly as possible, and then hand the baby to another nurse who's going to put the baby in a crib so that the pediatrician who's on call is going to take a look at the baby and make sure everything's okay. And that's where most shoulder dystocia problems come about or are discovered. Let me put it that way. So the pediatrician who comes in after the baby's born, they examine the baby from head to toe. And that's when they'll notice that something is a little off with the baby's arms, his positioning, his head. That's when they say, and that's when they start noticing palsy, which I'll go into in a few minutes.
Yeah, we're gonna get off into that in the next segment. But yeah, we're gonna take a station break right now. But I tell you, our viewers and our listeners out there, this is so interesting. If you want to be part of the conversation, all you have to do is just go to the platform that you're watching us and go to the comments, ask any question that you might have, or you can pick up the phone and call my producer at our KCBQ studios in San Diego. And that's 1-888-344-1170. Again, that's 1-888-344-1170. Remember, it's your life, and we'll see you shortly after the break.
There's more stories of greatness to help you overcome adversity coming up on It's Your Life with James Cooley.
Craving a slice of Chicago right here in Temecula wine country? Then dive into legendary Chicago deep dish style pizza at Rosati's Pizza Pub. Piled high with gooey cheese, rich tomato sauce, and your favorite toppings, Rosati's delivers the taste of the Windy City right to your table or front door. Enjoy the cozy pub atmosphere and an impressive selection of Temecula wines. Come on down to Rosati's Pizza Pub for your slice of Chicago right here on Rancho California Road, or order online at myrosatis.com. Rosati's, where Chicago deep dish pizza meets Temecula charm.
Dr. J.C. Cooley. The James Cooley Show. It's your life. Check it out. It's Dr. J.C. Cooley. Let's go. The James Cooley Show. It's your life. That's right.
Hello, I'm Dr. James J.C. Cooley from the United States of America, and I am here to just say, first of all, I'm so happy and honored to be honored to be in the Coffee Book 2023, Unified Brain Z, and the other organizations. Thank you so much for giving me an opportunity to be a part of this collection.
Noah Dingley here, producer of The James Cooley Show, It's Your Life. And the new audio version of James' book, Country Boy, City Boy, A Journey That Ain't Over Yet, is a must-have. James shares his true life story of struggle and success in America. It's both a cautionary tale and a roadmap to achieving the American dream. Get the new audio version of Country Boy, City Boy, A Journey That Ain't Over Yet by James Cooley on Amazon.com or wherever audiobooks are sold.
Hello, welcome back to the James Cooley Show. I tell you, welcome back to the James Cooley Show, and this guest right here is absolutely fantastic and sharing a lot of things and a lot of knowledge with our viewers and our listeners. Just like I mentioned at the beginning of the show, and Michelle mentioned, we never heard of this. So many things out there that the top docs of the United States of America, just like Dr. Lester Freeman is one of those top docs that can educate us and enlighten us and also put information out there that we all need to know. And Todd, you know you up right now. Information, because you're gonna have like 5 or 6 babies sooner or later when you get married. Tell me what your thoughts are, Todd.
Well, if I have that many kids, I'm going to need 3 or 4 more jobs. So, I have to say, I'm learning a lot from Dr. Freeman today, and man, I would have loved to have had him as a pediatrician, because I'm looking at his office, and behind him, I'm seeing Galactus, Magneto. I see that Neil Adams Batman 251 print. I mean, I love that. So that must be a cool way for you to connect with some of the kids is through comics.
And you know what? Not only I'm gonna give it that doctrine, but if you are there to see these things, he got them all. And one thing that Dr. Freeman is not going to tell you, he's one of the best authors. I'm talking about drawing and all that on record. Fantastic work, Todd. And
Thank you.
One of these days, man, when you hang out with me up in Atlanta, we'll go by and we'll check this out.
Yeah, I would love to. I love seeing all those figures back there behind him.
Okay, so this is so exciting. I'm gonna turn it back over to our Dr. Michelle because we got so much that we got to discuss, and I think she's gonna talk about this F.A.A.P. I don't know what.
Erb's palsy.
Okay.
Excuse me, Dr. Michelle.
Yes.
Okay. One of the things I forgot to mention when you asked me earlier regarding what some of the risk factors regarding shoulder dystocia.
Mm-hmm.
And I mentioned that.
Which one?
And I mentioned that diabetes and gestational diabetes was one of the risk factors for shoulder dystocia.
Yes.
And macrosomia. But also, one thing I forgot: pregnancy with twins or other multiples. Meaning, if you previously had twins,
mm-hmm.
then that increases the risk for shoulder dystocia. If you are massively overweight or you gain too much weight during pregnancy, that also increases your risk for shoulder dystocia. If you're extremely short, no shade on anybody who's short, but if you're extremely short, that's also a risk factor. If your pelvis is abnormal in any way, that's a risk factor. If you're older than 35 years of age, that's also a risk factor. And giving birth after your due date, they call that post-term.
Mm-hmm.
And usually the babies get bigger. The baby's going to get bigger regardless. And so when this baby's post-term, and it's usually heavier than 8 pounds, 13 ounces. And that also increases the risk for shoulder dystocia.
Okay, and let's talk about Erb's palsy. What exactly is Erb's palsy?
Erb's palsy. First, what is a palsy? A palsy is a paralysis or a decrease in function. Okay, and so an Erb's palsy is. Remember, I was talking to you about the brachial plexus, which is a network of nerves. Okay, that's located under both armpits, and they're usually from C1 to C8, and they're labeled. C means cervical, so that's from your base of your skull all the way down to almost like your clavicle, the bottom of your neck. And then there's the T, which is thoracic, and so forth and so on. T, then L, lumbar, then sacrum. But the key spots are from C1 through C8 and T1. And so what happens with Erb's palsy is that there's a disruption of those nerves. Okay, and so there's some sort of avulsion where either the fracture of the collarbone tears into that nerve network, So it literally rips from the spine and tears into that network. So when it ruptures, it's the nerve is torn. And so what happens is you develop a palsy, meaning now there's paralysis of that nerve in that segment. And so and that happens a great deal with shoulder dystocia. And it usually happens like 0.9 to 2.6 per 1,000 births, 12,000 cases per year. It's most common, like I mentioned before, in larger infants and who need to be pulled out because they're literally stuck in the vaginal outlet.
Well, besides the common factors that contribute to Erb's palsy, is there any type of test or, I guess an examination before birth that determines if an infant is suffering from that?
No. But the only test is clinical exam. So when the doctor sees the newborn baby and looks them over from head to toe, and they look at their shoulders and they look at their arms, and they have something called a waiter's tip position, where literally, I don't know if I can actually show you, but literally the baby is lying down, and you know how a waiter puts out his hand? They call it a waiter's tip.
Oh, turn around, Dr. Freeman. Yes.
Okay, yeah. I just wanted to demonstrate it to you. But they call it a waiter's tip. Okay. And so that's sometimes that can be, depending on the extent of the injury, it can be damaging for the rest of his life, or it can be slowly repaired over time using physical therapy and occupational therapy.
Wow. So what is the long-term effects of infants? I mean, besides what the doctor needs to do, to get them out the birth canal, what is the long-term effects of Erb's palsy to the infant? To
the infant, the infant won't notice what's going on with them until they're a lot older, until they become more self-aware. However, they will develop that, let's say it's more damaging than they thought it was going to be, and they'll develop that waiter's tip for life. And the only way they can minimize the damage is, like I said, through physical therapy and occupational therapy, massage therapy, those kinds of things.
Well, even if they go through all this therapy, this PT, will it resolve the issues of Erb's palsy as they get older?
It won't resolve it. It depends, like I said, on the extent of the injury. Now, if it's a minor disruption or avulsion of that nerve root, then there is a chance that the nerve will repair itself in time, and the patient will have a normal functioning hand and arm. But if it's really severe, if there's real damage where it's torn from the root, then the patient is going to have to look at some disability for the rest of his or her life.
Wow. So you've seen an increase in this condition beside this Erb's palsy as well as shoulder dystocia, correct?
I haven't seen an increase, but according to my OBGYN friends, they've seen an increase because people are getting heavier. And as you know, obesity is a big problem in this country and other developed countries. So the bigger the parents, the higher the numbers for diabetes and gestational diabetes, the chances are there's going to be more shoulder dystocia and more risk of brachial plexus injuries.
Hold that though, Dr. Freeman. We got to take a station break. This conversation, this discussion is so interesting, and we are learning so much. And I tell you, whichever platform that you are watching us on, was it E360 Television, Transfer TV, YouTube, LinkedIn, Facebook, Twitter, and over 68 other live platforms. If you want to be part of the conversation, all you have to do is go to the comments, asking the question that you might have, or you can pick up the phone and call KCBQ Studios, my studios, in La Jolla, California, San Diego, California. That's 1-888-344-1170. Again, that's 1-888-344-1170. And then you say, hey, Todd, hey, got a question, put me through. Todd will do that, and I'll tell you, we'll get you an answer. It's your life, and we'll see you shortly after the break.
There's more stories of greatness to help you overcome adversity coming up on It's Your Life with James Cooley.
A black man's point of view.
Really get a chance to know who you are. And once you know who you are, you truly know who you are, love who you are. Love who you are. You're a masterpiece. Love who you are. Love who you were born to be. Love me some me. That's what I'm talking about. When you leave high school, you gotta know today or tomorrow, or hopefully today, what your plans are. Hopefully, there is no bad decision unless there is no plan. Create, collaborate, commit with confidence. Commit with what? Commit with what? And everything that you do.
Southtown, and realization that life would never be the same. Cooley lays out his struggle to adjust from city life to country life and back again, sharing his hard-earned lessons to educate, encourage, and enlighten our next generation of leaders and heroes. Get your copy of Country Boy, City Boy, A Journey That Ain't Over Yet by James J.C. Cooley, available on Amazon and everywhere books are sold.
Craving a slice of Chicago right here in Temecula wine country? Then dive into legendary Chicago deep dish style pizza at Rosati's Pizza Pub. Piled high with gooey cheese, rich tomato sauce, and your favorite toppings, Rosati's delivers the taste of the Windy City right to your table. Or enjoy the cozy pub atmosphere and an impressive selection of Temecula wines. Come on down to Rosati's Pizza Pub for your slice of Chicago right here on Rancho California Road. Order online at myrosatis.com. Rosati's, where Chicago deep dish pizza meets Temecula charm.
It's the James Cooley Show.
Hello. Welcome back to the James Cooley Show. It's your line. I tell you, I thoroughly enjoying this special guest, by the way, family guest. And I believe, Michelle, that he is enlightening us with so many things unto our viewers and our listeners to get a better understanding that everything don't go perfect in childbirth or anything in life.
Mm-hmm.
But what he is doing is laying out some of the things that he knows as a top dog pediatrician, and some of the things that he is encountered with doing childbirth and other things, and he is laying it out to educate our public that these things could happen to you. I know he talked about depending on a lot of different things, the size of the parents and uh, all of these type of whether they big, small, that could be issues. And I want to pick it back up with that, but also I want to say, hey, I want to thank our viewers and our listeners. We are syndicated now. We syndicated across the country, across the world. The James Cooley Show is your life, and I tell you, Monday through Friday live at 2 p.m. Pacific Standard Time, to 3 p.m. Pacific Standard Time. But we also, the best of the James Cooley Show is also KCBQA on 1170 Answer FM 96.1, comes on every Friday, not every Saturday and every Sunday at 9 p.m. Pacific Standard Time. If you missed anything, you can go back, just tune in, you can watch it. And so I had to put that plug out there for us, Michelle, because I'm so happy about, thankful. And Todd, I know you there, my producer for 6 years. Thank you, buddy. Thank you. Thank you. Thank you.
You're welcome.
I'm going to turn it back over to you, Michelle. And we got about 6 minutes left in the show.
Oh, thank you. So, Dr. Freeman, when should treatment begin with those infants afflicted with Erb's palsy or shoulder dystocia?
Like I mentioned earlier, it all depends on how severe the injury is. The average patient who actually they can recover from this within 3 or 4 months with actually no therapy if the injury is mild. However, for more serious injuries, they usually start within 3 weeks of birth. So with physical therapy, that means range of motion exercises, stretching exercises will help prevent stiffness in the baby's arm, wrist, and hand. And the reason why you do that is because you want to avoid something called a joint contracture, which is a permanent joint stiffness. You want to avoid that. So the parent has to be very diligent in providing instructions on how many times they do those movements, those range of motion movements every day. Also, hydrotherapy combined with the exercise also helps. So the hydrotherapy provides support because some of the exercises to some of the babies are considered, painful. So the hydrotherapy makes it less painful. The provider, if it's severe enough, may want to inject something called Botox, which everybody's familiar with by this time, to paralyze working muscles for a time to force weaker muscles to take over. So it's actually tricking the muscles. So it paralyzes the strong muscles so that the weak muscles can take their place and develop on their own. And they may also splint the baby's hand to prevent it from curling inward. Because like I told you, that waiter's tip I awkwardly showed you earlier, it would eliminate that curling that the baby has and make it less rigid. Now, if it's really, really, really severe and there's extreme impairment, they do surgery where they have a nerve repair, where that includes nerve grafting, nerve transfer, and nerve decompression. And sometimes they even do muscle repair, where they move a muscle or tendon to replace the damaged tissue for another place in the body. But the results are, questionable.
So my question is, let's say this is left untreated. All right. The mother, the parents know that the infant suffers from shoulder dystocia and Erb's palsy. And if it's left untreated, that PT doesn't happen. Now, you mentioned long-term joint stiffness, but
Right.
what is the most severe repercussions of it being completely untreated?
A complete loss or weakness of muscle function in your arm and shoulder. That is severe impairment. It's not fatal, but it is a disability. And so anybody who has, a lot of people, even babies are not the only ones that suffer from Erb's palsy. If someone was in a terrible accident and this part of their body was the brachial nerve plexus was disrupted, they can also develop an Erb's palsy too. So, but since I'm a pediatrician, I don't deal with that sort of trauma. I deal with the trauma in utero and at the time of birth. And so there's usually severe impairment that they have to live with for the rest of their life.
Dr. Freeman, we're down to the last 2 minutes of the show. And for anybody that wanted to reach out to you to get more information from you or enlist your services, especially in the Atlanta area, how could they do that?
They can give me a call at area code 404-691-4321.
Dr. Freeman,
yes.
I believe that this conversation that we had is so impactful. I would love, if you have time in your schedule, for you to come back on the show and kind of do other things and enlighten our viewers and our listeners on pediatrician, childbirth, all this other type of things. I don't know if we have time, but I'm extending that invitation out right now. So,
and I will heartily accept. But thank you.
Yeah, and I want to thank Dr. Freeman for taking the time to come on the show today. I'd like to thank my lovely wife, Dr. Michelle Cooley, for putting together another absolute outstanding show. I'd like to thank my producers, especially back in my California studios, KCBQ AM 1170 Answer FM 96.1. But most importantly, I'd like to thank our fans and our viewers for tuning in to the James Cooley Show, It's Your Life. Always dream big, think big, and be big at everything you do. Just like I said, 9 p.m. Pacific Standard Time, you can KCBQ AM 1170 Answer, the best of the James Cooley Show this way. Dream big, think big, and be big at everything you do. We'll see you real soon.